Well, let's now speak to the leader of the Scottish Conservatives, Douglas Ross, who joins me down the line. Douglas Ross, thank you very much for joining me. First of all, the First Minister was announcing at the briefing just in the past 24 hours there have been 7 deaths recorded, the highest number since the 17th of June. I was just saying to Linda Bald, quite a shock for people, perhaps quite a shock for you as well.
Absolutely, and I want to express my deepest sympathies and condolences to the families who have lost a loved one. It has been some time, as you say, since we've recorded that number of deaths, and it's a stark reminder that we're still in the middle of this pandemic. We've still all got to unite to fight this together, to keep the infection rate as low as possible and to try and prevent as many deaths from this horrible virus.
Now, at the briefing, the Social Security Secretary, Shirley-Ann Somerville, was announcing a £500 grant for those on low incomes to self-isolate. Of course, Boris Johnson announced that for England that came in on the 28th. Are you pleased now to see that there is that similarity between England and Scotland with that grant?
Well, I called for this some time ago when there was a trial approach to this in England. I asked for it to be extended to Scotland, and I think it's right that this support is available across the United Kingdom.
Now, Ms Somerville was calling for what she called consequential funding to actually fund this grant. So essentially, Barnett consequentials, money that if that is spent in England, that would also be spent in Scotland. Will that money be coming to Scotland from the UK government to pay for this grant?
Yes, I would expect so. We've seen throughout this pandemic that the UK government have ensured there has been significant support going to all 4 nations of the United Kingdom. The Scottish Government has received an additional £6.5 billion to help.
Douglas Ross, I think we're maybe having some problems with your line at the moment. I think it's slightly frozen. We'll just see if we can get back to you. I don't think we've got you just now. Perhaps we'll return to you shortly. And Douglas Ross rejoins me now. Sorry, Douglas, a little glitch in the line there. Let's just pick up where we left off. You were saying that money would come from the UK government to pay for this £500 grant to help people self-isolate. Just to recap.
Yes, I was saying, Andrew, that throughout this pandemic, the UK government have delivered more than £6.5 billion to Scotland to ensure we are able to fight the pandemic as strongly as possible. There will be consequentials, Barnett consequentials from the announcement in the UK government, which has ensured we've been able to roll this out across the whole country.
Now, one other funding aspect, which was mentioned at the briefing, and we've picked up on this before actually, the First Minister was saying again that support for business does not go far enough, and she was still looking for more discussions with the United Kingdom government about support for business. Ms Sturgeon was really criticising the Chancellor's latest package. What's your response to that?
Well, I've said throughout this, Andrew, that people expect both of Scotland's governments to work together, and what we have seen is an extremely comprehensive package of support from the UK government. The Fraser of Allender Institute reported that the furlough scheme was one of the most ambitious and significantly positive developments any country has introduced during an economic crisis. And I think we need to build on that work that has supported jobs and local economies. And I'm asking the Scottish Government to do more, because we need the Scottish Government to use the powers that they currently have. And I announced in my own jobs plan a few weeks ago a number of measures they could immediately take in Scotland to help local businesses and local communities who are affected by further restrictions.
In fairness, though, do you think they can do more? Because we've heard for a number of months now the Scottish Government calling for extra borrowing powers, so they feel they could do more if they had that financial helpline to do so. But where can they maybe get the money to do more if more funding is not perhaps being offered from the United Kingdom government?
Well, we saw in the Chancellor's statement last week that there is more funding and more support coming from the UK government. But in my jobs and economy strategy that I launched within my first month as leader of the Scottish Conservatives, I outlined a series of measures that could be introduced right now, immediately, to help businesses, individuals and communities right across Scotland. These are with the powers the Scottish Parliament and the Scottish Government currently have, and with resources that are available to them. So there are measures that both our governments can take. We've seen huge investment and huge, significantly positive measures from Rishi Sunak. I now want to see the same from the Scottish Government.
So we've seen very heavy hints from the Scottish Government, perhaps, that they would like to take more action on hospitality at the moment. So you're thinking that actually if they wanted to close down hospitality, even perhaps in some local areas, they could do that with the money that they perhaps already have?
Again, I've suggested a hardship fund for areas that are affected by further restrictions. We've seen parts of Scotland that have had more restrictions in recent weeks and months than other parts. So again, the Scottish Government can and should direct support when it's absolutely needed.
Let's just pick up on hospitality at the moment, actually, because I was mentioning to Linda Bald, there's one student pub in Aberdeen that has been linked to 62 cases of coronavirus among Aberdeen University students. That's a very high number, and of course it almost reminds us of what was happening during the Aberdeen lockdown. Do you think more action should indeed be taken against hospitality? One almost wonders if so many cases come from one pub, what exactly might be happening there?
Well, I think we have to look at individual examples, but we shouldn't have a broad brush approach and criticise a whole sector because of potentially one or two bad examples. The hospitality industry is one that is effectively facing what they call three winters during this pandemic, and it is an industry that we need to support because it is so much about what we do in Scotland across the whole country. We rely on a strong and healthy hospitality trade, and I want to see them getting support from the UK government, as they have had through the furlough scheme, with the VAT reduction now extended until March. There's a lot of positive work being done with the hospitality industry, and I want to see the Scottish Government supporting them as well.
We've picked up on some aspects relating to the economy. Let's pick up on some aspects relating to the health emergency now. We're hearing from the Chief Nursing Officer, Fiona McQueen, in the briefing, and she was just talking about the kind of reopening of services, as it were. Now, yesterday we're hearing about some poor figures about cancer treatments, of course, a very unfortunate byproduct of coronavirus because a number of services being suspended, screening stopped and so on. The Conservatives were calling this yesterday a ticking time bomb. What concerns do you have in particular about cancer treatment and other vital health services that perhaps have to be put on hold or suspended or delayed because of coronavirus?
Well, of course, they have been delayed and suspended in many instances while the NHS got on top of the initial wave of coronavirus. Now we've got to look at continuing the support and the outstanding work our nurses, our doctors, and our staff have done in hospitals throughout this pandemic, but ensuring other illnesses and urgent diseases are treated as quickly as possible, because people did shield in many cases. They did stop going to hospital and doctors for more routine appointments, and we've got to ensure that we do not allow this to continue for too long, and there's not such a big backlog that there are severe and serious consequences of not dealing with these issues right now as well. And I think now, while there is a concerning rise in the number of cases, and sadly, as we spoke at the beginning of this, an increase in the number of deaths, there are now opportunities to open up areas of the NHS to ensure these vital operations and services reopen to get people the treatment they need.
It is a concerning picture. Hospital admissions are going up, as the First Minister was pointing out, and the First Minister was talking about a dangerous complacency, perhaps. How concerned are you about a rising number of coronavirus cases, which could then further impact on NHS services? I suppose the key thing is that people adhere to the public health messages and, to use the old phrase, save the NHS, what we were talking about back in March.
Absolutely. And these aren't easy decisions for any government to take or for anyone to hear and follow. It's a difficult time for us all, but we know that we'll only get through this, and we'll only get through it together if we all follow the guidance, we all follow and live with the restrictions that are with us at present, because it's crucially important, it's vitally important that we get on top of this virus again, we reduce the infection rate across the country, and we absolutely minimise and hopefully then eliminate the number of people who are sadly losing their lives as a result of COVID-19.
Douglas Ross, leader of the Scottish Conservatives, thank you very much for joining us on the programme today.